My mother-in-law got scammed by her cardiologist. Yeah, I guess more than just chiropractors can do it too. There are grifters in medicine, and I'm going to tell you some things to look out for so that you're not getting scammed by physicians that aren't following evidence-based medicine and instead are following revenue-based medicine, which unfortunately does happen. She was seeing a cardiologist to get surgical clearance, and well, she didn't have any symptoms, but the surgeon wanted her to see a cardiologist to double check and get checked out. Well, he ordered a Holter monitor, he ordered a coronary artery calcium scan and all these things, and she was okay taking those because she's a little bit of a hypochondriac. I love you if you're watching this. But then he came back and he said, we need to order a stress test because your triglycerides are high, your cholesterol's elevated, and so we need to make sure, and I can't give you surgical clearance until we get the stress test. And that was enough. She put her foot down and she's like, this doesn't seem right. And it wasn't right. She came to me and she asked me, because I do anesthesia and I do this stuff. And to be frank, I wouldn't order any of those tests on an otherwise healthy patient with no symptoms. Stress test was not indicated based on her lack of symptoms, etc. So how can you tell when something might be a red flag when it's coming from a physician? First, ask what the test changes. It's a fair question. How will this result to this test change my treatment? If the answer is vague, like, we just need to check just to make sure, be hesitant. Second, be cautious when you don't have any symptoms and someone's offering you a test. If you feel well and tests keep getting ordered and you have no symptoms, that doesn't sound right. And that's something I actually see with a lot of chiropractors. Third, watch for fear-based language, like if we don't do this and we miss it, something really bad can happen. And if they're very vague and non-specific, just be mindful that that's kind of sketchy. And fourth, look for any resistance to a second opinion because a good physician would welcome a second opinion. Ones that aren't following evidence-based medicine don't. You are the captain of the ship and we're just helping you guide the ship, okay? So you get the final decision about what test you are and are not okay doing.